The options for tightening your skin fall into more or less one of two major broad categories. One is if you have a lot of extra skin, it's really best treated by shifting that extra skin back towards your hairline and in front and behind your ear, and trimming off the excess and hiding the incision line around your ear and in the hairline. That's, of course, a facelift or a modification of a facelift or a neck lift. But you don't have to always go with surgery. There are now a number of non-invasive techniques that can be employed in order to tighten skin. They range from employing ultrasound energy, which is transmitted through the skin, not injuring the superficial layer of the skin at all and actually tightening the muscles underneath it, to other techniques which slides a probe underneath the skin painlessly and tightens the fibers that connect the overlying skin to the muscles and to the tissue deep to it. And it's rather fascinating. It just causes those strands to contract and it tightens the entire skin. You can also tighten the skin by directly stimulating the overall skin itself and getting a secondary feature, which is the elimination of fine lines and wrinkles and even pigmentation issues or pores. That would be your typical resurfacing, your laser resurfacing, or aggressive dermabrasion, or even micro needling. That injures the superficial layer of the skin, and by that process, you're inherently getting the collagen to be reformed and tightening the deeper layers called the dermis. So there's really two major categories. You could call it more invasive, which is the surgery, neck lift, and facelifts, and then the non-invasive, whether or not they're what's called ablative, which means they're actually injuring the skin in some fashion, requiring a skin recovery, or non-ablative, which means the overlying skin itself stays fresh and normal and uninjured, but you still get a tightening effect of the skin.